Hi, I'm Dr. Anusha GP, Consultant Fertility Specialist at Cloud9 Hospital, Tanisandra, Bangalore. IVF and ICSI are both assisted reproductive technology which involves fertilizing the egg in a lab, forming embryos and transferring it into the uterus. IVF is a traditional method where the sperms are mixed with the egg in a lab dish and left to fertilize on its own overnight. Whereas ICSI is a procedure where the embryologist selects the best sperm under the microscope and injects one single sperm into the egg using a microscopic needle. So ICSI is indicated in cases especially when there is a male factor infertility like low sperm count or low motility or poor morphology of the sperms, or if there is history of previous fertilization failure where the sperm was not able to penetrate the egg. Whereas IVF can be done in cases where it's a female factor infertility or unexplained infertility. Both have similar success rate with respect to fertilization, implantation or pregnancy, but the overall success depends upon various other factors as well, like the age of the patient, especially of the woman, then the reason for infertility and the quality of the embryos. So after taking detailed history, initial assessment and evaluation, your clinician and embryologist would recommend the best treatment option available that would help to maximize your chances of pregnancy.